Hi there. My name is Dr. J. Michael Bennett. I'm an orthopedic surgeon specializing in sports medicine with the Fondren Orthopedic Group. Today we're going to talk about a new technique, a new technology that's out there regarding rotator cuff repairs. Typically the standard for rotator cuff repairs has always been an anchor repair, meaning that you have a rotator cuff tendon tear, we put an anchor in the bone, we have stitches that come through the tendon and reattach that tendon down to bone to allow it to heal. That has worked great for full thickness rotator cuff tears, and it's also worked great for partial tears where you've had to actually remove the degenerative tendon and create a full thickness tear to repair it. Recently there's been a new technology that has been introduced in regards to treatment for partial tears. If you have a patient that has a high-grade partial tear, instead of having to go in there and fix it with anchors and a stitch, we have the option now of laying a graft on top of that partial tear and basically creating a healing environment for that rotator cuff tendon and allowing that tendon to heal from the inside out. The graft that we use is a xenograft, meaning it's actually from an animal. Now it's been sterilized, but the graft itself acts as a load-sharing augment. So what that means is that if you have a patient that has a partial tear of the rotator cuff, instead of going in there, releasing this tear and putting an anchor in, now what we're doing, we're introducing a graft that lays on top of that tendon like this, almost like a Band-Aid that lays right on top of the tendon, and you fixate it with a couple of, just an anchor down here and some absorbable little staples in there. Now what that does is that it covers the defect and it allows that rotator cuff tendon gives it almost like a rest. It allows it to heal. The problem with these partial tears is that there's continuous motion across the shoulder. These partial tears never get to heal. But what we've found in regards to some of the early studies that we've seen with this graft is that you'll start to see some bridging of this tendon back down to the bone as the tendon basically heals itself. And then the graft on top is incorporated by your cells. So all your cells basically go into this graft and incorporate it, and then over time that graft becomes a part of that tendon. So you've created a thicker, and in essence, in the end, you've created a thicker tendon that is healed, and now it's part of your rotator cuff. And you no longer have that partial tear. Now the interesting thing about this treatment option is that it's cutting rotator cuff post-operative healing in half. So typically when we do a rotator cuff repair with anchors, usually you're looking at about a 6-month recovery before you get back to any kind of heavy lifting, back to the gym doing your regular activities without restrictions. Now that all depends on the quality of the tendon and how many anchors and things like that. So that's a general I'm speaking generally. Now regarding this augment here, usually the full return to activities without restrictions is about 3 months. So we're cutting our recovery time in about half. So this is a very good option for patients that have a partial tear, that want a quicker recovery, that still want to proceed with a minimally invasive option. And it's called the rotation medical graft, and we are currently using this in our office as well in patients that are candidates for this type of procedure.